Hi, I'm Anissa, and today I'm going to be presenting on strabismus. Strabismus is a disorder in which the eyes don't look in exactly the same direction at the same time. It is also referred as the cross-eyed, and 4% of the population, or about 13 million people, are affected by this. There are 4 types of classification what it fits into. So we have inward turning, which is esotropia, outward turning, exotropia, upward turning, hypertropia, and downward turning, hypotropia. And I actually had this as a kid, and I had esotropia. For symptoms, it appears in infants and young children, usually by the time they turn 3 years old, but it can also appear in older children and even adults. You can have headaches, eye strains, cross-eyes, double vision, difficulty reading, tilting the head to look at certain objects, and frequent blinking or squinting, especially in bright sunlight. Now for causes, children can be born with it, so it is inherited, and only about 30% of those children with strabismus actually have a family member with a similar problem. Also, muscles with the that take place in the control center of the brain that directs eye movements, head injuries which can damage the area of the brain responsible for control of the eye movement, poor vision one eye, brain tumors, and strokes, which are the leading cause of strabismus in adults. For diagnosis, we will usually do patient history, where we will ask questions like, did the problem come on suddenly or over time? Was it present in the first 6 months of life, or did it occur later on? Is it always present or only part of the time? And is there a family history of strabismus? We will also do visual activities like having you read letters from an eye chart to examine the eye's behavior. Refraction, where we check the eyes with a series of corrective lenses to measure how they focus light. Alignment focus test, and examination after dilation, which is where you put eye drops in the eyes, and it's determining the health of internal eye structures. And for treatment, eyeglasses or contact lenses, which will help the eyes need less focusing effort and may remain straight. The permis lenses, which are special lenses that can bend light, entering the light, and help reduce the amount of turning the eyes to look at the objects. Wearing an eye patch, which is what I had to do as a kid a lot, and I didn't like it. But you would typically only wear the eye patch for 2 hours per day, and you would wear it over your strong eye, so that way you're forced to use your weaker eye, which will kind of help to straighten it out and just improve the eye coordination, eye focusing. And vision therapy to train the eyes and brain to work together to improve eye coordination and eye focusing. And you can take medications like eye drops or ointments, and surgery where they change the length or position of the eye muscles so that the eyes are aligned correctly. This is usually performed under general anesthesia, and we finish it off with double stitches. So for follow-up, you will have to come back and see the doctor just so we can make sure that everything's going correctly, you're improving. And if it is caught early enough, it is treatable, and you will typically be fine. But if it's not caught early, there can be complications as developing a lazy eye. And these are the sources that I use. So if you have any questions or concerns, feel free to ask me, or you can look at these websites that I use.